Starting from October 1, 2024, Canada will no longer require travelers entering the country to use the ArriveCAN app, provide proof of vaccination, undergo testing, quarantine or isolate, and monitor and report if they develop signs or symptoms of COVID-19. The decision to scrap the country's COVID-19 vaccine mandate at the border and make the ArriveCAN app optional was made by Prime Minister Justin Trudeau on September 30, 2024, according to a senior government source. The source said the move was based on the advice of public health experts and the low risk of importing COVID-19 cases from abroad. The ArriveCAN app was launched in April 2020 as a digital platform for travelers to securely provide mandatory travel information, including their COVID-19 proof of vaccination and quarantine details, before and after entering Canada. The app was intended to help the federal government monitor, assess, and respond to the COVID-19 pandemic as it evolved. However, the app was also the subject of a blistering Auditor General's report in February 2024, which found that the government overpaid for the app and the Canada Border Services Agency, CBSA, mishandled the file. The report revealed that the app cost taxpayers about $60 million, a price tag considerably higher than initial estimates, and that the CBSA's record-keeping was so poor that the total cost of ArriveCAN was impossible to determine. The report also raised concerns about the lack of oversight, transparency, and accountability in the procurement process, as well as the potential privacy and security risks of the app. The Conservative Party of Canada called on the Auditor General to open an investigation into every government contract with GC Strategies, the company at the center of the ArriveCAN app scandal. The RCMP also confirmed that it was assessing the available information, including the Auditor General's audit report, and taking appropriate action. In response to the report, the government said it suspended all contracts with GC Strategies in November 2023 out of caution and implemented many of the recommendations in the report. The government also said it created an executive procurement review committee to approve contracts and task authorizations, required employees to disclose all interactions with potential vendors, and increased the procurement group's capacity to oversee all procurement activities. Health Minister Jean-Yves Duclos said that the government was ready to end the border measures as Canada had achieved a high vaccination rate and a low COVID-19 case count. He said the government would continue to monitor the situation and adjust its policies as needed. He also thanked the travelers who used the ArriveCAN app for their cooperation and patience during the pandemic. He said the app was an integral part of Canada's monitoring program for the early detection and identification of new COVID-19 variants of concern, and critical to the federal government's ability to protect the health and safety of Canadians.